Hinton with the Oklahoman and Oklahoman.com. I'm here in the studio with John Gladden. He is president and CEO of Delta Dental of Oklahoma, and Dr. Daniel Wilgus. He is current president of the Oklahoma Dental Association and co-chair of an event called Oklahoma Mission of Mercy. Thank you so much for coming.
Thank you.
I really appreciate it. Can you share some basic information about Oklahoma Mission of Mercy, Doctor?
Sure. This Oklahoma Mission of Mercy was created 11 years ago. This will be our 11th year.
Okay.
It is a unbelievable event that's put on by the Delta Dental of Oklahoma Foundation, the Oklahoma Dental Association, and the Oklahoma Dental Foundation.
Okay.
And the three came together 11 years ago and decided to try all we could within the dental community to make a difference in the lives of the most vulnerable in our communities. And so the way this got started was we have a dentist in Tulsa by the name of Dr. Rieger Wood, who kind of took this as his charge.
Okay.
And here we are 11 years later. We've been to Oklahoma City, Tulsa,
Okay.
several times, and then we've also gone out to areas outside of the metros. We've been to Woodward, McAllister, Durant. This year we have the opportunity to take it to Stillwater.
Okay.
On February 7th and 8th. It'll be held at the Payne County Expo Center.
Okay.
And it is an event where anybody with any need dentally can come and be treated.
Wow.
We ask no questions.
Okay.
It costs them nothing.
Okay.
We don't ask for identification. They just come and we try to do all we can for them
Okay.
in the arenas of dental hygiene, simple dental restorations if
Okay.
they've got cavities that need to be taken care of. We also do extractions, and in isolated cases, some root canals
Okay.
as well.
Wow. Okay. So that's very extensive.
It is extensive.
Okay. Okay. Well, good. Good. So, how many volunteers does it take to put this on? Well, I'm thinking
takes
a lot.
It takes a lot
Okay.
of volunteers. We typically say 1,500
Wow.
volunteers. We're happy to report that this year we have over 2,000 volunteers
Okay.
already committed
Okay.
to join us in Stillwater on February 7th and 8th.
Okay. So these are dentists.
These are dentists,
Okay.
these are dental hygienists,
Okay.
these are students from the Oklahoma College of Dentistry
Okay.
and the Oklahoma College of Dentistry Hygiene Department as
Okay.
well. We have, more than anything, non-dentists, lay people
Okay.
who are taking time out of their busy lives and
Right.
schedules
Okay.
to be a part of something that's extraordinary for a community such as the size of Stillwater.
Okay, okay, interesting, interesting. So what kind of response does the Mission of Mercy event typically receive? How many people are typically served through this event?
Well, we typically see about 1,500 people
Okay.
each time. As so far, we've seen 16,000
Okay.
people that have come
Wow.
through the doors in the various events that we have. Normally, about $1 million in care is delivered at each event.
Okay.
And people come for lots of reasons. One of the important things that happens that we don't talk about very much is the diagnostic side. Many times they come here because they've been in pain for sometimes weeks and months. Sometimes it's intermittent pain. They're really not sure what their problem is. But one of the first things that we do once we get them registered and set up is we triage the patients, and the dental professionals look to see what are their needs and what are the most pressing needs, and then they go through our process. But even at the end, because we rarely can reach all of their issues, we try to consult with them about where they can go after this event to receive follow-up care and establish a dental home so that they can take care of some of those longer-term needs.
Okay, okay, so you're talking x-rays, that sort of thing?
Absolutely.
Wow.
It's a beautiful clinic that's set up. The
Okay.
America's Dentist Cares Foundation provides the equipment that travels the nation.
Wow.
There'll be 30 missions of mercy across the United States this
Okay.
year. And they have more than 100 operatories in these trailers with everything that it takes to set up this huge 100-chair dental clinic, everything from panoramic x-ray machines to handheld work to drills to lights. It's an amazing kit that's set up. It's kind of like a military MASH medical facility is
Okay.
established. And over that 2-day period, it just hums the whole time, and a lot of dentistry is done. And as the doctors mentioned here, not just dental professionals, but non-dental professionals as well will be on the floor doing hundreds of different kinds of jobs, like feeding 2,000 people
Okay.
over the course of 2 days.
Okay. Okay. Well, one of the things that I wanted to ask you about was, why is it important for your organizations to put this together? I know that there are a lot of uninsured people who come to these events. They may be just one aspect, one segment of the population that comes. I'm assuming that would be a large part of the population that comes?
Sure,
Okay.
sure. It's, you know, in the state of Oklahoma, we do have some access to care issues.
Okay.
We do have an underinsured population.
Okay.
And we have people in our state that are living on a day-to-day basis, as John alluded to, living in pain, living with infection.
Right.
And we want to take it from the dental side, try to help them regain and restore some of their health, get them to services also if we detect something else that needs to take place, that we can get them in the hands of some other professionals as well. And as John said, to try to find them a future dental home going forward.
Okay, okay. I like that idea of connecting them with an actual dentist that they can go to on a regular basis. That's great. That's great.
Very important. It's one of the reasons why we move it to different locations, is so that people don't just wind up making this their dental home.
Okay.
Because really the very basic needs are met here, and more extensive needs to be in a dental practice. And for Delta Dental of Oklahoma, we're involved in this since the very beginning because we're a not-for-profit company. And our mission is oral health for all Oklahomans, whether they have dental benefits or not. And only about half have dental benefits and the other half don't. Even Medicaid, of course, is only for children's dental, emergency extractions only for adults. So there are a lot of working adults out there that need this care. When we got together with the Oklahoma Dental Association and their foundation, it was pretty clear that it required three things to pull this off. It required a lot of volunteers, a lot of organization, and a lot of money. It cost about $150,000 to pull one of these programs off, even just for a couple of days. And that's with a great amount of volunteered materials, Patterson Dental Supply, Medical Waste Services, Henry Schein, United Rental, Chick-fil-A, Aspen Coffee in this case. Takes a lot of players to make this happen, dental professional and not. And even this year, you know, we'd like to ask if anyone out there can help us with the food side of this. It's an area we could use some assistance. We provide some basic meals that are there for the people that are in line and for the volunteers, and some help on that would be wonderful.
Okay, good, good. Okay, so you're needing people to volunteer to bring meals or to donate meals, is that right?
Donations would be best, although sometimes we have churches that bring the meals and donate them at the same time. And
Okay.
they set up their whole kit and cook for everyone. It's wonderful.
Okay, good, good.
The Baptists are wonderful at this.
Okay,
The
but I was
Southern
thinking
Baptists,
Baptists. I was
they're
thinking the
incredible.
Baptists.
They are
I cover
fantastic.
religion, so a
They've
lot of
helped
times
us many times.
they do that a lot.
Yes.
And that's the nice thing in these smaller towns too, or you know, outside of the metro, is the churches and the civic groups do get very actively involved, and it's an opportunity for them to step out and serve as well.
Sure, sure, sure. Well, is there anything else you'd like to add? Anything that we haven't talked about? You've done a great job kind of explaining everything, but if there's something else you'd like to talk about?
Well, we just like to make sure that folks understand that there are no qualifications to be here.
Okay.
Not even identification is required. If you have a need, you can come. We do have indoor waiting for those that want to spend the night. Some folks want to get in line early and spend the night, and we do our best to give them shelter and some warmth, although spending the night on a concrete floor wouldn't be my first choice.
Right.
I think it really speaks to the level of need, the urgency of that need for the people that are there. They go through a lot of trouble to be here, and they can expect us to treat them with compassion and consideration and respect and move them through this process, and maybe we can just make their life just a little bit better.
Okay, great, great. Well, thank you so much for coming.
Thank you.
Thank you so much. I'm hoping someone out there gets this information and takes it and makes good use of it.
Thanks.
Thank you, Carl.
Yeah, thank you. For more information, read the Oklahoman or log on to Oklahoman.com.